Can an eyebrow lift fix my caveman brow? I've always hated how long my brows are, and I find myself raising them in photos so that I don't look so unintelligent and bored. They just sit there in a straight line, and they're so low that I can't apply eye makeup and have it be visible. I don't feel that it's an issue with the brow bone, just my eyebrows. Would a brow lift solve this problem?
Thank you for your question. I'm amused by the way you refer to your eyebrows as caveman eyebrows, and you're asking about the benefits of a brow lift. So, this is a very common question when people have issues about the relative position of their eyebrows and how it looks over their eyes and the recruitment of skin over the eyelids. So the question always is, does it make sense to do a brow lift? Does it make sense to do a blepharoplasty or upper eyelid blepharoplasty? Does it make sense to do a combination of both? Now, the aesthetics of eyebrows is something that most surgeons will disagree about. And there is definitely a lot to do with the personal desires of the patient as well as the artistic vision of the surgeon. In the mid to late 90s, it was very popular to perform brow lifts. And I've seen that over this time in the Northeast, in our area, New York, brow lifts actually decreased in popularity over time. Unfortunately, a lot of people were getting their brows lifted and they looked always surprised. And that's a look that really doesn't resonate very well, except in very specific social cliques that we don't need to go into. My focus in my practice is about a natural appearance. And the perception that I have about the position of the brows and how it looks on an individual really is about the character of the face. And it is something about the way brow position is that has such an impact on the expressions of a person's face. If you were to draw just a cartoon and you arched the brows or then you made them look face downward, you can change the expression significantly. Well, that's what happens when people decide to undergo brow lifting surgery. Now, there are different aesthetics throughout not only our area, but also throughout the country. When I have visited colleagues in other parts of the country, I have seen how the desire for very high arch brows is very popular in certain regions. So this is a very personal question for you to decide. Now, when you do raise your eyebrows, yes, you feel like there's a lot more eyelid showing. But the question that you need to answer is it worthwhile to have your brows arched all the time? I think that based on the photo you submitted, in order to achieve that, the brows would have to be raised fairly high. In my opinion, looking at your photo, I don't think that would look natural. And so I would ask you to consider some type of upper eyelid surgery as an alternative to brow lifting. Now, of course, this is being a recommendation or suggestion that's being made in the absence of a proper physical examination. But understand that a brow lift is a procedure that can significantly affect your facial expression. If for any reason you feel like that is the look that you desire, then moving forward with the brow lift would make sense. From my aesthetic, I think that a high arch brow on you would take away too much from the character of your face, and that revealing more of the upper eyelid will probably achieve a significant percentage of the desired look you are aspiring for or aspiring to. So again, think about the long-term impact of having brow lifting surgery on the overall facial expression, not just on the isolated area of the eyes. And then consider the alternatives of doing an upper eyelid blepharoplasty, and then do your research and meet with qualified, experienced cosmetic surgeons, and then move forward with a plan that you're comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.